happen. When you own a business and you have other people involved, creating a full team approach comes from a foundation. And I really appreciate what you've done in creating that space. And I think we all have a lot to learn and to appreciate from that. So I appreciate that. I'm really excited to be here and talk about osteopathy. I walk a lot, I move a lot, I'm very kinesthetic. My hypnosis mentor was like, you are the most movement-oriented person I have ever known. Even in trance, I'm moving. So here we go. Everybody has a body, right? So I love talking about osteopathy, like I said. Osteopathy, first off, who's heard of it? Okay, good. Osteopathy just turned 150 years old. Woohoo! June 22nd, we turned 150 years old. That's when A.T. Still, the founder of our profession and the one who really laid down the philosophy from which we all practice, flew the flag, as the story goes, on osteopathy. So 150 years. It's really fun to be a part of it. I am one of 2% of DOs who use the manual manipulation. DOs comprise, I have to take some notes because numbers. DOs comprise 149,000 physicians in this country. In this country, we are medical physicians. There are doctors of osteopathy, osteopathic practitioners, all throughout the world. In the United States, we're medical physicians. And we went to medical school, we did residency, a lot of us do fellowship, and that's why only 2% of us, like when I say 2% of us do the manual manipulation, that's where that comes from. So we're 11% of physicians, and 25% of current medical students are in osteopathic school. So we're experiencing a huge growth. And what's really fun is that I get to talk about the human body, and I get to explain and encourage my patients to connect with their human body. How many people here do that? How many people find that so many people have been taught pretty much from day one to give the knowledge of their body to somebody else and to look to somebody else? And how many times do you have a client or a patient walk into the room and you're like, ooh, you're not in your body. Like you can feel that, you can sense that. There's that whether it's fear, whether it's not trust, whether they've been told that a rib pain is actually, oh, that's your shoulder. And they're like, I feel like it's coming from here though, right? So we all get to encourage our patients. I think one of the reasons that we're all here is that we get to encourage people to really connect with who they are. And when we look at the foundations of the tenets of osteopathy, every osteopathic medical student, whether you practice OMM or whether you're not osteopathic manipulative medicine, every single DO is able to recite these, whether in their first year of medical school. So the principles, the body as a unit, and a lot of these may resonate with other practices as well. Right? So when we look at this, the body is a unit. The person is a unit of body, mind, and spirit. Right? How many of us believe that? And feel that and know that healing comes from the integration. It's not the reductionist model. We've benefited absolutely in many ways from the reductionist model. But as you've noticed, I'm sorry, I can't remember your name.
Yeah, Ash.
Hi, Ash. When we get locked into that single reductionist, this is the one cause that's causing the one problem, right? We kind of lose out on the entire being. Not only the physicality, but the emotionality and the spirituality of the person. So all of us, I believe in this room, are interested in the integration of what that means and what it means to the individual, what it means to the community, what it means to the collective, right? Second principle, the body is capable of self-regulation, self-healing, and self-maintenance. And now a lot of times, that's a real powerful statement, right? The body is able to heal itself. There's a caveat that's a little missing, when it doesn't have restriction, right? So a lot of us work with the physicality of the body, and what are we doing? If you're myofascial, if you're musculoskeletal, right? Even in hypnosis, what are we doing? We're removing restrictions, right? We're allowing the body to breathe and to move and to flow. So as an osteopathic physician, I know that not only are you nervous system, not only are you lymphatics, not only are you, blood and organs and organ tissues and everything, you're fascia. Who here works with fascia? Right? Fascia, absolutely, right? You can tell, how many times patient's legs, or part, and you're like, wow, you're wound tight all the way this way, right? You can see the fascia. Those of us whose eyes tune into that. Others of us in the cranial sacral world, I also practice osteopathy in the cranial field. So how many of us recognize the body as a fluid dynamic, a fluid space, right? And what is it? It's motion. So we're constantly oscillating between motion and stillness. I tell my patients health and healing happen in the stillness. And so how do we get to that when the motion comes to a still, it's called a still point after AT still. It comes to that still point, and then the body and the organ systems breathe. And there's a whole respiratory motion with that. So self-regulation, self-healing, and self-maintenance when restrictions are not present. And so restrictions can look like a lot of things, right? Third thing, structure and function are reciprocally interrelated. Well, that's a lot of language, right? So it just means how well you can function is based on the integrity of your structure, right? I mean, that makes sense. We all know compensatory mechanisms, right? You hurt your right ankle, and then you start limping, and then that affects your pelvis, and that affects your shoulders, and then that affects your head, right? So the entire being. So patients are often confused because they're like, wow, I came in with a shoulder problem, but you're starting at my feet. And I'm like, absolutely, because compensatory patterns, right? I've had a colleague treat my entire body by lifting my toe, and completely, that's what I needed at the moment. The entire body just unwound, So it's fun to explore that dynamic, right? And that's something else that I invite everybody to do is come, and I invite my patients as well, look at your body with curiosity, right? I wonder what that means, as opposed to, oh, this is broken. It's information. What is that? What is that telling us? What is that telling us about your existence? What is that telling us about your experience? What is that telling us about your being and your perspectives on health and healing? And then the fourth one is basically rational treatments based on all the others, right? So to be a full, complete, in this realm, osteopathic physician, all treatment is based on the integration. So whether you're an internal medicine doctor and don't do any osteopathic manipulation, there's still the concept that your entire being works together in these mechanisms. I can talk